are you today?
Good.
Do you have any symptoms today?
No, I feel fine today.
Okay, then I will start from taking a vital signs. First, I'm going to take your blood pressure. Alright, your blood pressure is 165/95, which is relatively high for normal. And it might mean that you have hypertension.
I have a history of hypertension over the last few years, and I've been taking hypertension medications and anticoagulants.
Oh, so what kind of blood clots you had before?
I have a history of DVTs.
Okay. And I'm going to listen to your heart. Then I will count your pulse. So your heart rate is 120, which is relatively high, higher than normal, but it's common for hypertension.
Yeah, I usually have a high heart rate.
Okay, so a doctor who specializes in disease of the heart, she will come in and talk to you, and also your lipid profile is coming back from the lab, so she will also talk with you about that. Okay?
Okay.
See you.
Hi, I'm Dr. Smith, the cardiologist. We ran your blood test and we have your results back. So through the lipid profile, we found that you have hyperlipidemia, which is caused by an excess amount of fats in your bloodstream.
Is that from my diet?
It's influenced both by your hypertension and your diet. So when an increased amount of fats gets into the bloodstream, it can build up and cause a hardening of fatty plaque on the arterial walls. That's called atherosclerosis, and when this occurs, it causes the blood vessels to constrict and narrow, making it more likely that clots can form and clog your arteries.
Am I at a bigger risk for this because of my DVTs?
Your history of clots does put you at more risk for forming clots in the future, which is why you need to work extra hard on the prevention of the formation of clots. Some of the best ways to do this are through diet and exercise. You want to decrease the amount of fats in your diet and increase the amount of exercise that you're getting.
I eat a lot of fast food. That sounds hard.
It will take a few adjustments. It's definitely a lifestyle adjustment, but it's really important for your health that you do. So, do you ever smoke?
Yeah, I smoke every day.
Oh, really? Smoking is actually one of the biggest risk factors for cardiovascular health, so trying to quit is actually one of the best things that you can do. I can have the nurse bring you some more information on this.
I think that'll be really hard, but I could try.
Yeah, it is definitely an adjustment and will be hard, but it's really important to manage your lipids and your blood pressure so you aren't at risk for more serious cardiovascular diseases in the future. We need to try and prevent the arteries from becoming occluded, because then a much more serious condition could occur, such as a heart attack.
That sounds kind of scary. How does all of that affect my heart?
I'm so glad you asked. So here we have a model of a human heart. So the blood flows into the heart through the inferior vena cava and the superior vena cava, which are both a part of the venous system. The blood flows into the right atrium and then travels through the tricuspid valve into the right ventricle. The blood then flows through the pulmonic valve into the pulmonary arteries and goes to the lungs to get oxygenated. It travels back through the pulmonary veins into the left atrium, which is the other one of the upper chambers of the heart. The blood flows through the mitral valve into the left ventricle, where the blood is forced through the aortic valve into the aorta, where the blood goes to the rest of the body. The heart also has its own set of veins and arteries. The coronary arteries are tiny arteries on the heart that supply the heart with the oxygen supply it needs. These arteries are very small and can get occluded if clots form.
Ready.
42-year-old female who complained of severe chest pain. She was given nitroglycerin sublingually, but the chest pain persisted. She has history of hypertension, hyperlipidemia, and DVTs.
Okay. Let's get her set up. Okay, get the head of the bed raised. Someone start taking blood pressure. Nurse, I need you to draw labs. I'm gonna listen to her heart.
Keep breathing, man. We're gonna make you better. Move your arm.
Okay, patient has an abnormal heartbeat. She has shortness of breath. She's sweating and coughing. She appears anxious with reports of severe chest pain. She's most likely having a heart attack.
Blood pressure's 210/95.
Okay, I want to start her on thrombolytics therapy as soon as possible. This is so we can help minimize and break up if there's any coronary occlusions. Do you have the labs back yet, anyone?
Her troponin is elevated, which means she has myocardial infarction.
Okay. I want her started on an ACE inhibitor. Someone write this down. ACE inhibitor, statin medication, and aspirin as soon as possible. We need to minimize any ischemias that she has because remember, time is muscle. Let's go.
Okay, I'm giving her the intracoronary thrombolytic medication now.
Reassess you real quick.
We got you, man.
Okay, heart rate is slowing down.
Are you feeling any better?
Okay, she appears to be more stable right now, but we need to keep a close eye on her. Nurse, I want you to monitor her vital signs frequently and report to me if she has any major changes.
Okay.
Okay.